Huger, and today I'll be presenting about the range of motion and the manual muscle testing in the posterior tibialis. So for the range of motion, the posterior tibialis is a deeper muscle in the calf, but there are still some stretches that you can do to test the extensibility and the range of motion of it. So the first stretch that I have down is the hamstring wall stretch, and this will be this photo down here with this client laying down, and then she's having her heel really placed against the pressed down and placed into the wall. The more that you push that heel into the wall, the more you're going to feel the stretch in the posterior tibialis. And obviously she's trying to keep her leg is straight in that. You really want the client to keep the leg as straight as possible during that one to really feel the stretch. Another one that I have down is the hamstring wall stretch. And then this is the one where the client is using the wall to help them balance so they don't fall over during the stretch. And they have their front knee bent and their back knee straight. And the side with where the back knee is straight is the one that you're going to really feel the stretch in the posterior tibialis. That's also a great stretch to test the range of motion. And then we also have commonly called the shin stretch. It's actually stretching out the anterior tibialis as well. But the shin stretch is really good, and it's really key to make sure the client is not sitting down in between their ankles. You really want them to be on top of their feet with their glutes on their heels, because you don't want them to sit in between their ankles, because then they won't feel that stretch as much. But these are just a few stretches that can be used to test the extensibility and flexibility of the posterior tibialis. So now for manual muscle testing, there are a few different ways that you can test, like the eccentric and the concentric of the manual muscle testing. So for concentric, you are going, as a practitioner, you're going to resist as the client tries to plantar flex and invert their leg. And then for eccentric, you're going to have the individual resist as you try to push them out of plantar flexion. So I'm going to go ahead and show a YouTube video on manual muscle testing for the posterior tibialis. All right, so that was a good example of what manual muscle testing looks like for the posterior tibialis, but I also did want to include just a few isolation exercises. I know that will be talked on later in this presentation, but I thought this was really cool how this person's doing a heel raise with a tennis ball in between their feet. Obviously, that's kind of something that you don't see a whole lot, but the reasoning behind having the tennis ball while you do the heel raise is so the posterior tibialis can be really, really isolated during that movement. And another great exercise that also does strengthen the ankle joint as well, but also does isolate the posterior tibialis, is the ankle four-way with the resistance band. You obviously use a pretty light TheraBand for this exercise, but resisting in 4 different directions can help strengthen both the ankle joint and the posterior tibialis. So that is all.
Hello, my name is Ashlyn Caudill, and I will be presenting some isolated exercises as well as where you're going to be seeing the posterior tibialis worked. So I actually would like to start with where you're going to see this in our functional and real life. So with the posterior tibialis, this is a really good stabilizer muscle. So right here on the right is the posterior tibialis, and as you can see, it is running from your knee all the way into your kind of like your heel ankle area. And with this, you're going to be seeing a lot of help with running, walking, jumping, maybe sprinting. So we're going to really want this muscle to be healthy and strong so we can continue these daily activities we're going to be using this muscle for. So we're going to head back over here with our isolated exercises. So how we can get this muscle up to functional movements and strong so we can complete these. So for lengthening and stretching this muscle, we're going to be seeing more of this gastrocnemius and soleus stretch of the wall or just sitting down. A lot of geriatric patients are not flexible enough to put their foot on the wall, or it's not stable. So a good alternative is to take a band, a belt, and prop that foot up and just bring your foot towards you with a band or that belt. This is a really good stretch for the overall calf area. There is not a super specific stretch specifically for the posterior tibialis, so these stretches will get the posterior tibialis. It's just not going to be super isolated for the stretches. Below here, you can see a stretch called a soleus stretch. This is going to target the soleus muscle as well as our general calf muscles. For this one, instead of planting that front foot forward and bending it and keeping this back leg straight, we're going to have a little bit of a bend here just to get a little bit more isolated down here towards the ankle. And then for our strengthening exercises, we're going to see a couple here. We have internal rotation of the ankle. For the internal rotation of the ankle, you can either do this without a band. Maybe the patient's just working a little bit more of that range of motion, but also wants to activate that muscle. We're going to internally rotate our ankle. If this is too easy, we can add a band. So let's say this band's going to be right here, adding a little bit of resistance, still internally rotating that ankle, activating that muscle a little bit more. We can switch the bands to make it easier or harder based on how the patient or client is feeling. Another good alternative for this one is to sit down on a chair and braid one leg over the other, and we're going to bring that heel or ankle up towards the ceiling and then slowly lower. This is also a good way to work that muscle eccentrically, so we can work on really focusing and engaging that muscle on slow and controlled movements. This will really help with maybe walking down the stairs, working on that slow and controlled movement, and overall just strengthening that muscle. Below here, you'll see some heel raises. Instead of our standard heel raises where we're not using a step, we're going to be up on our toes and then slowly lowering. You can also go at a normal speed, but again, with the slowly lowering, we're working on slowly focusing on lowering in that controlled movement. We're going to add a ball in between the heels to specifically target that posterior tibialis, and that way really focus on strengthening that muscle in itself. Thank you so much for watching.
I'm Ashlyn, and we did the posterior tibialis for the muscle presentation. For the muscle overview, the posterior tibialis is anatomically in the posterior view. Its origin is 2/3 of the posterior surface of the tibia and the fibula. You know, its insertion is every tarsal bone except for the talus, but its main two are the navicular tuberosity and the medial cuneiform bone. Compared to other muscles, since the posterior tibialis is more deep into the leg, the lower leg, that means that the actions of this muscle can be referred to as more secondary versus primary. Its isolated function is in the concentric action, where ankle plantar flexion and inversion of the foot occurs. The eccentric action would be ankle dorsiflexion and eversion, and the isometric action is what stabilizes the arch of the foot. For the antagonist of the posterior tibialis, that would be the peroneus longus. The origin of this muscle is the lateral condyle of the tibia. Meanwhile, it inserts in the medial cuneiform. While the posterior tibialis has a concentric action of inversion of the foot, the peroneus longus everts the foot during the concentric, which would make it the antagonist. It also decelerates dorsiflexion in the eccentric action, which is opposite of the eccentric of the posterior tibialis, as the posterior tibialis aids in dorsiflexion during its eccentric action.
Okay, so the first test question is, what would you expect someone with a flat foot deformity to acquire? And the choices are anterior tibial tendon dysfunction, plantar fasciitis, posterior tendon dysfunction, or poor eversion of the ankle. The answer for this would be posterior tendon dysfunction. Second test question is, when walking, the posterior tibialis plays a major role in A, lateral stability, B, knee extension, C, propulsion, or D, shock absorption. The answer to this is lateral stability. The second test question is, which anatomical structure is closely related to the posterior tibialis tendon? A, patellar tendon, B, Achilles tendon, C, peroneal tendon, or D, flexor hallucis longus tendon. And anatomically, the answer for this question would be B, Achilles tendon. Next question is, which nerve innervates the posterior tibialis muscle? Given that it is saying tibialis muscle, it will be B, tibial nerve. Last question, which activity is likely to strengthen and engage the posterior tibialis muscle? A, running, B, riding a bike, C, jumping, or D, swimming? The answer to this question is D, swimming.